Hi everyone, this is Mr. Neil Wright here, consultant audiologist and director of Clearwax. Thank you for joining me in another demonstration video of our recently developed WAXscope. I have a patient here with bilateral, fully occluding soft earwax. I initially used our standard size 4.25mm speculum, but I then switched to the smallest one that we have, which is a 3.5mm, because they have got a very narrow and also quite bendy ear canal. And as you can see, we're using this 3.5mm speculum to dilate the ear canal. I've just adjusted the focus there. You could see how clear the wax is now in view. And I'm just slowly but surely trying to suction this out of the ear. The occlusion extends right from the entrance all the way to the patient's eardrum, so it's quite a substantial blockage. The WAXscope will be, we're hoping to launch in the next couple of months. If you are interested, please do email info@clearwax.co.uk. We will have a more accurate date hopefully next week after speaking to our tooling manufacturers who are going to be injection moulding our speculum. So there's the patient's eardrum. You can see it's very narrow ear, but the eardrum's nice and healthy. Just some residual soft wax just at the entrance, and this is a good view actually. It shows you how bendy and twisted the ear canal is. You can see the speculum is directed straight into the ear, but the ear canal veers off to the right quite sharply. So this is the same patient. This is their right ear. So again, I'm just using the smaller speculum. I'm just going to dilate the ear, get the view of this wax, and get it in focus. And I'm just working from the bottom up, trying to peel this away from the base. There's a bit of keratin there as well. The patient had been using some olive oil spray prior to attending, hence why the wax is a bit more softer and wetter than it would have been otherwise. And you can see this top layer of keratin that I'm just peeling away. There we are, that's at the roof of the ear canal. So that's actually just dead skin. There's a long sheet of it. It keeps blocking the tube, that's why I keep coming out of the ear. So once more, I'm just dilating the ear, just adjusting the focus to get it in really good view. And we're getting some really good feedback from our clients with the WAXscope, and that includes existing clients whereby I've previously used the iClearScope, the endoscope. As mentioned, the WAXscope is not a replacement for the endoscope. The iClearScope, we're still going to be manufacturing and offering that, but the WAXscope is, in my personal opinion, and with the jury be out, you'll be able to compare our videos to others, and if you're already doing wax removal using loupes and microscope, you can make a direct comparison. But I honestly believe that the WAXscope is the next best alternative to the iClearScope. And again, that is my personal opinion, but everyone's entitled to their thoughts. But what's great, we can upload the videos and you can see for yourselves. And that's the challenging cases as well. So most of the WAXscope cases, if you look at our YouTube channel, I'm trying to upload some of the more complex cases with the WAXscope. So you can really, for me as well, it's important to put the WAXscope through its paces to make sure it can deal with the really complex ones. And so far, it is holding its own, which is great. So just mopping up near the entrance, the ear canal's clear. Just, you have some residual wax around the edge. We're not overly concerned by that. So I think I might just remove this just so I can get a bit better view of the patient's eardrum. But a bit of wax is good for us. I think we should be stressing that more to our patients. Speaking from experience on my YouTube channel, and sometimes you get some negative comments because there's a bit of wax here and there, but it's not necessary to remove all the wax. In fact, it's good practice if you leave some residual wax, because by attempting to do so, you may traumatize the ear. So I hope you enjoyed that video, guys. And once more, if you are interested in the WAXscope, please do email info@clearwax.co.uk. Thank you. Bye.